Thank you, Madam Chairwoman, and I appreciate all of you making time. Thanks for sharing your insights. This issue is about standards, and I think it's a really important issue. It's one that I think most of us hear a lot about. Standards that in some cases are leading to food being not eaten, tossed aside. Also standards that are creating a significant financial burden on school systems as well. And I've heard from school administrators in my state of South Dakota who tell me that the higher cost of food needed to meet the USDA standards has resulted in financial loss, and even in the release of school employees, just so that school can meet its financial obligations. And so as we look at this issue, I think we have to remember that there isn't any federal law, regulation, or policy that should be considered a gold standard and not to be changed. I think the responsibility of this committee as we discuss the reauthorization of child nutrition laws is to approach this important mission with open minds and with a spirit of cooperation, and not be unduly influenced by the position of those who support current policies and standards and who are not open to meaningful change. I wanted to direct a question, if I might, to you, Ms. Bauscher, and that has to do with an issue that's a little bit specific to my state of South Dakota, but I'm sure shared by others around the country, because I've heard from students, parents, school administrators, child nutrition directors, food service managers about the impact these standards are having. But there's a particular letter that I would like to talk about, and that's one I received from 200 students who attend the Pierre Indian Learning Center in Pierre, South Dakota. And they want to be able to have traditional foods that are part of their culture served once a month in the school cafeteria. But because of the inflexibility of the new nutritional standards, they're not able to do that. And so my question is, how can we work in this reauthorization to ensure students are receiving healthy, nutritious meals while at the same time allowing flexibility to meet these types of requests? And I would say, especially in areas in Indian country and areas that I represent and other members as well represent around the country.
Well, in school districts around the country, we are increasingly serving a very diverse student population. In my own district, there are over 120 languages spoken. So the importance of their own eating heritage is very important to them, and we look for ways to incorporate those foods. And again, I would be hopeful that during the 2015 reauthorization, we would also look at that and include reasonable flexibility that would allow students to enjoy the foods of their culture in the school meal program.
Thank you. Dr. Wilson, do you believe schools are getting consistent and adequate amounts and types of technical assistance in order to successfully implement and meet the current requirements?
Well, I think we're just beginning with technical assistance, and like I said, the resources have been out there for a long time. I think what's happened is we probably put the cart before the horse, because as Ms. Wiggins mentioned, that in some states there's absolutely no requirement for your educational level to run a school nutrition program. And back in 1990, we started talking about that really didn't make sense to run a federal program and not have any kind of educational requirement at all. In some states, it's just up to the local district who should be running the program, irregardless of the size of the program. And so, I mean, I know of some districts that are really in trouble, but part of the problem is that not that they don't want to, it's that the person leading the program is not able to. And so the whole issue of professional standards is really, really important, because you can make all the rules you want, but if you don't understand how to do them, then that doesn't help. But helping with professional standards and having people, and it is too bad we have to require it, but obviously in some districts they don't do it. And I know that I've worked in a very small rural district, only 1,700 kids. Back in 1990, they were throwing away 18 gallons of milk a day in the elementary school. So we decided to do something about that and to be proactive. It wasn't about because of the kind of food we were serving, it was the milk they were dumping in a bucket to throw away. And that was back in the early 90s. So that's nothing new. There's got to be proactive ways to deal with food waste and find out why is it being wasted. We switched in our district and we did recess before lunch. It had a huge impact on food waste. Huge. Kids weren't worried about whether they're going to get out and get the soccer ball or not. Right. So I think there are lots of anecdotal things going around as to the blame as to why things are happening in the school lunch program, but I don't think we've done any good digging as to what really is occurring. And as far as professional standards is concerned, we do need to have an opportunity for people to be educated. And many people say, well, the small school districts can't do it. Well, in the nursing home situation in this country, you're required to have a registered dietitian oversee your program. Now, I'm not saying every school district needs a registered dietitian, but the very small nursing homes in every rural county in this country have to have somebody that comes in either once a week or once every other week that does some oversight for them, helps them with menu planning, helps them with purchasing. Those are the kinds of models that are working very well for nursing homes. So there is a way. In my district of 1,700, we increased participation. We put a fund balance in place. My superintendent loved it because of the things that we did. And one of the things it was back in the 90s was putting better standards in place because I come from a nutrition background. So it's doable, but we're just beginning this change. And I think it's going to take a few years for this to really see the outcome of us moving forward with this.
Quickly, Ms. Wiggins, anything to add to that? Thanks.
I'm very sensitive to ethnic preferences among children. I'm from Detroit, and contrary to popular belief, I have a large Middle Eastern, I have a large Hispanic, and a few Lithuanians and here and there, but African Americans as well. We do serve ethnic foods, but you can't serve them healthy. Just give you an example. Black people really love collard greens and a lot of fat. But now we've changed it since we knew how much it impacted our health, things of diabetes and overweight, that now we can enjoy. My kids on Soul Day, we have black-eyed peas, collard greens, sweet potatoes, and cornbread, but they're all within the guidelines of the USDA. It's not like Mama's, but it is an awareness that that food can be eaten.
Okay. Thank you. Madam Chair, I guess we have a vote on, and so thank you, and thank all of you for being here.